Mr. President, I rise today in support of the Affordable Care Act and to discuss the devastating impact its potential elimination would have on rural families and rural communities. My state, Virginia, has so many rural communities, and in that I am with every other member of this body, and I want to talk specifically about them. The Trump administration has sought for years to end the Affordable Care Act using every tool available. They've worked on their front on that task here in Congress to repeal it, sabotage it, and even dismantle it in the court system. And today marks another milestone in that deeply troubling effort. The Fifth U.S. Circuit Court of Appeals will hear oral arguments in a case that could strike down the Affordable Care Act in its entirety. If the ACA were struck down, families and communities around the country would bear life-altering consequences, and the health care system would be thrown into chaos. Tens of millions of Americans would lose health care coverage and protections for pre-existing conditions, among the countless other consumer protections that have been put in place by the ACA. A number of my colleagues are going to be on the floor this afternoon speaking about particular aspects of this that trouble them. I want to focus on one in particular: how important the Affordable Care Act's Medicaid expansion is to rural America, and how much is at stake for those communities should the ACA be eliminated. Medicaid expansion enables low-income rural residents to get affordable quality health insurance so they can get the care they need. It is often the case that insurance companies do not compete in the same intensity in rural communities because there's just not enough patients. And so it's common in rural America for somebody wanting to buy an insurance policy on the exchange, for example, to maybe only have one option. And so Medicaid expansion has turned out to be a huge benefit for many low-income people living in rural America. Many of those who are receiving insurance pursuant to Medicaid expansion have been previously uninsured, and so for some, it's the first insurance that they've had in their life. A particular impact of Medicaid expansion has not just been on individuals receiving that Medicaid, but on the hospitals that are sort of the healthcare and even economic pillars in rural communities. Rural hospitals often have a difficult time making the finances work. Again, lower patient volumes makes it difficult. But Medicaid expansion has meant that care that they've been providing that in the past might not have been reimbursed at all, they're able to get at least a Medicaid reimbursement, and that has meant significant financial benefit to these hospitals. Mr. President, you understand this because your state is like mine, where there's a lot of rural communities. Rural hospitals are often the lifeblood of rural communities. They can be the largest employers in a town or a county. They're often places that do not just within the hospital walls, but a tremendous amount of outreach outside the hospital walls on health care and other philanthropic, sponsoring the Little League teams and doing the things that make a community a community. So residents of rural communities need access to health care, but they also need access to jobs and good health care information. Rural hospitals provide that. I've seen the impact of rural hospital closures in Virginia firsthand. 2 rural hospitals in Virginia closed in recent years because Virginia did not expand Medicaid initially. In the last year, Virginia hasn't done Medicaid expansion, but before Medicaid expansion was done, we saw hospitals closed in 2 communities in Virginia: Patrick County, which is a South Side Virginia county that is on the border with North Carolina, and Lee County, which is a far southwestern Virginia county that's on the border of Kentucky, Lee County and Kentucky and Tennessee, and 2 hospitals have closed in those communities. I got a letter from a mother in Christiansburg, Virginia, which is actually up near Virginia Tech. Her name is Robin, and she wrote about the closure of the Pioneer Hospital in Patrick County in 2017. She wrote this: "My mother, who recently turned 70, still lives in Patrick County, and we're approaching a point of either the family having to move back to Patrick County to be near her, or moving my mother to Christiansburg, where we currently live. My son has severe food allergies that could lead to anaphylactic shock, which would require immediate medical attention. So this variable also weighs very heavily on my mind when considering the options of how to manage my family's land and take care of my mom. I don't want to live somewhere without access to emergency health care. It seems inconceivable that this is the case in the era in which we live now. Please help get my home county back on the medical map to give its economy and its people a fighting chance. So Blacksburg's probably an hour and a half to 2 hours away. Mother living in a county that now has no hospital. She's turning 70, so she doesn't have access to care that she needs. Daughter trying to decide, do I move back? But I've got a son who needs care because of allergies. Do I have to move my mother out of the home where she would rather stay? Rural hospitals across the country are struggling to keep their doors open for a number of reasons. But here is an amazing set of statistics. Whether a state expands Medicaid pursuant to the ACA is a massively significant factor in rural hospitals' financial outlook and decision-making. Without Medicaid expansion, rural hospitals may be forced to cut vital services or even to close. Here's the data point that really says it all. Since January of 2010, 107 rural hospitals have closed in the United States. 93 of those 107 hospitals were in states that had not expanded Medicaid at the time of the closure. Hundreds more rural hospitals are at risk of closure. Rural hospital closures disproportionately occur in states that have not expanded Medicaid. The success of the Texas case would wipe out the ACA, including Medicaid expansion, and deeply penalize these rural hospitals. A comprehensive 2018 study in Health Affairs found that Medicaid expansion is directly associated with hospital financial performance, and that expansion substantially reduces the risk of hospital closure, particularly in rural areas. The study also found that going back to pre-ACA eligibility for Medicaid would drive even more rural hospitals to closure. So we think about Robin's dilemma, a mother living in a rural area where the hospital is closed. If the ACA is struck down and there's no Medicaid expansion, this is going to be faced by more and more and more rural communities across the country, and then that means this is a dilemma that's ultimately faced by individuals and their families. Research from Georgetown University's Health Policy Institute indicates that the uninsured rate for low-income adults in rural communities fell 3 times as fast in states that expanded Medicaid as compared to states that did not expand. Turn that around, states that expand Medicaid find that rural families have a dramatically higher likelihood of having insurance than those in rural areas where the states haven't expanded Medicaid. As of now, 36 states, including Virginia, have expanded Medicaid, 14 have not. I'm thrilled that earlier this year, Virginia, after a multi-year battle, finally announced that Medicaid expansion was happening, and in less than a year after expansion, nearly 293,000 adults are newly enrolled in Medicaid in Virginia, many of whom never had health insurance before in their life. 293,000 adults in a state where the population is about 8.5 million. That is a significant number of people who have received insurance through Medicaid expansion. They risk losing their eligibility if the administration is successful in its efforts to gut the ACA. If we care about rural residents and rural communities, there's a number of things we can do. First, we need to stand up against the administration's attempt to end the ACA, including its Medicaid expansion. I have now been in public life for 25 years, since I was elected to the Richmond City Council in May of 1994. I will say in all the elections I've been in, up or down, and all the various legislative and other battles, the single most dramatic moment in my life as an elected official was standing on the floor of this body at 2 o'clock in the morning when Senator John McCain, fresh out of a hospital being diagnosed with a glioblastoma, a brain tumor, cast a deciding vote, and by one vote, we save the Affordable Care Act. I've never in my life experienced in the public realm something that was so dramatic and so consequential. We have to continue to stand up. I would have thought that that vote might have moved us to a new chapter where we're talking about fixing and improving rather than about repealing. But that's not the case, as evidenced by the lawsuit today. But my hope is that we will resist efforts to sabotage and destroy and instead join together in efforts to improve. I've joined with my colleagues to co-sponsor a resolution allowing the Senate Legal Counsel to intervene in the lawsuit to defend the Affordable Care Act. The second thing we can do to help rural communities is focus on the 14 states that haven't yet expanded Medicaid and provide them a clear path and an encouragement to do so. I'm proud to be an original co-sponsor of something called the SAME Act, which would extend the same level of federal assistance to every state that chooses to expand Medicaid, regardless of when the expansion occurs. And I think that's important. Let's use the original Medicaid program as an example. It was passed in 1965, and it was not a mandate. It was an option. The last state, Arizona, state 50 that joined, didn't join until 1982. So there was a 17-year period between when the first state joined into the then voluntary Medicaid program and when the last state did. Let's make sure that whenever states join, they're treated the same. If this bill passes, states that choose to expand now, these 14 states, would make sure that they get the full federal level of assistance as was available to those states that initially joined. And that should help remaining states get off the sidelines. Finally, we need to stand up against administrative sabotage of the Affordable Care Act. We shouldn't promote skimpy insurance plans. We shouldn't slash funding for enrollment, for outreach, for marketing. We should build on and improve, and yes, fix, because it's not perfect, fix the ACA to extend its promise of affordable coverage to even more Americans. That's why I've introduced Medicare Acts, legislation to establish a public insurance plan that could be offered on the ACA exchanges beginning in rural areas. My bill would also make the ACA's tax credits more generous, expand tax credit eligibility to additional families, and allow for an enhanced reimbursement rate in rural communities where low patient volumes often pose financial challenges to healthcare providers. In closing, the ACA has meant the difference between life and death for many families across the country, and I run into them every day. I'm going to be standing with some Senate colleagues on the steps of the Senate in a few minutes, talking about a youngster from Winchester, Virginia, who has a series of significant health care challenges that would essentially in the past have made him uninsurable because of a pre-existing condition, but who now, because of that protection within the ACA, he and his family at least have the peace of mind of knowing that he can't be kicked off insurance or turned down for insurance because he happened to be born with a condition over which he had no control. If the ACA were to be struck down, families and communities would suffer, and I think in Virginia that would particularly be the case in our rural communities. And again, I'm just going to hold up this issue of our rural hospitals. We need to protect rural hospitals not only because of the health care they provide, but because they are employment centers and centers of community outreach. And when we see the closure of rural hospitals overwhelmingly being in states that have not expanded Medicaid, that tells us how valuable that portion of the ACA has been to stabilize the provision of rural health care. I will continue to fight to protect the ACA and the health of my rural communities in Virginia and elsewhere, and I encourage my colleagues to do the same. And with that, Mr. President, I yield the floor, and I note the absence of a quorum.